Hello, everyone. I'm Solomay Tibabu, the host of Going Digital Behavioral Health Tech, and I'm super excited to be joined by Dr. Dubois from Mindstrong today. Welcome back, Dr. Dubois. Tell us a little bit about your role in Mindstrong, please, for those who aren't familiar.
For sure. Thanks, Solomay. So happy to be back with you today. I'm a psychiatrist by training, but I had the sort of dumb luck, I like to say, of landing in telehealth long before it was cool and pre-COVID, over 10 years ago now. And through that work with rural health centers, crisis centers, community work across the state of Texas, I was drawn to Mindstrong several years ago and really opened my eyes to really the new frontier, right, in digital behavioral health and what the potential was. And I've been dedicating all of my time here for the last couple of years now as Chief Clinical Officer, and absolutely love what we do.
Amazing. And Mindstrong, I know we talked a bit about last year, but lots has changed since then. Tell us a little bit about the services and technology that you provide to so many different stakeholders.
Awesome. Thanks. Yes, Mindstrong, really was built. We like to say we started with the hardest first, right? So we started with individuals only presenting with a serious and persistent mental illness. So for those of us in the field, we know that those are the folks who are the hardest to reach, hardest to treat, hardest to get well. And we're able to engage them really well digitally. So we've got engagement rates, up in the 40% after 18 months in care, which is pretty, unique. So we're proud of that, but we realize that there's a lot more people, right, that we could be reaching with acute or moderate mental health needs. And so we've really widened our aperture and our service model to accommodate them. So we're now taking any individual who wants to use their insurance or wants to pay privately for services. We're making sure that our app meets everybody where they're at, not just those who come to us assigned from any particular payer. Our model has really evolved and become more complex as a result. So we've got service lines of care partners or coaches, therapists, and psychiatrists who are able to meet members where they are any step in their journey.
That's great. And so consumers get to utilize the services, but in terms of who you partner with, is it also enterprise like health plans, employers, or who are you working with in terms of B2B?
Yep, all of the above. So we're just stepping our toe into the employer space, working with so many different health plans now. Thanks to our growth team has become robust and hit the ground running. I think we're covering 8 million insured lives now across the country, still operating in the same states that we have been. We really recognize the need. So just in Texas alone, the need is sort of outstanding. That's where I am. So it's something I like to vouch for, but we're going to go deep in the states in which we operate, make sure that we reach everybody that we can there and continue to expand.
Tell us a little bit about some of the new services that have been released lately.
Thanks. Yeah, our team is providing active therapy, psychiatry services, but our care partner team, akin to a coach, these are highly trained, specially trained individuals who are in our team. And really what we found is they're meeting our members' SDOH needs. They're making sure that they're attending their appointments, allowing for any gaps in care, things that aren't allowing our members to reach their goals in therapy, for example. So to us, this is really exciting. And this opens up sort of a lot more opportunity there for individuals who need, another connection point, right, in their journey. And so having that flexibility has been key for us.
That's really great, because it's like if you can offer a mental health service, that's one thing, but if patients can't even access them, then what's the point? So that's really exciting. Thank you for sharing.
Yeah, for sure. And we know that those social determinants, right, like for folks, especially with a serious mental illness, they're profound and they have a huge impact on their ability to engage and then sustain any outcomes. And so what we've really found is having our care partner team be that rung in the step care ladder allows us to ensure folks don't regress and stay connected.
For those who aren't familiar, can you walk me through what it's like to be a patient just signing up?
Yeah. And I think, For any clinical folks out there, I think we all know that somebody walks into your office or walks into a hospital and they may believe that they are suffering from one condition or have one label. And, we may find something very different that we can assist them with. So I say that all to say that some of the very first things that a Mindstrong member does, and they're oriented to services and the opportunity, is take a survey across all of mental health domains. We don't want to assume that we know anybody well until we've asked them all of the relevant questions, which means across all mental health domains. From there, we have a really detailed, individualized approach to measurement in care, and also then in stepped care. So if someone comes in and informs us with our trans diagnostic survey or through their first interview with a care partner that they have really moderate or severe symptoms, then we know that they're probably a good candidate for active therapy and or medication management. And that's really, we meet members where they are. We don't believe that everybody needs, I like to say that not every symptom is a disorder and not every disorder requires medication, even as a physician. We just firmly believe that in our values. We prescribe only when necessary and appropriate, and members are allowed to participate in therapy in ways that they like, whether that's video, text, or phone. We've seen tremendous engagement with text therapy. I think probably the world is seeing that, especially post-COVID. And so we offer all modalities, and then we monitor folks. Once you're entered into care, you're also entered into measurement, right? And so we're allowing folks to communicate with us in between session, and we're communicating back to them. Hey, the survey looks good or not. Hey, your data looks good or not. Do you want to get back in touch? Do you want to come in more frequently? Things like that, and allowing people to really continue in their life, but stay connected to their mental health care.
And in terms of different populations that this intervention is appropriate for, in terms of youth, adults?
Yeah, right now we're 18 and up. So all of our providers will see any adult. And really, right, because the system is flexible and yet also personalized, we're going to recommend content to you that's specific to the problems that you have, not generic videos or, workbooks that aren't coincident with issues that you're telling us that you have. We really feel like we can meet members across the entire acuity spectrum. We don't rule anybody out, even those who've been really significantly ill or suicidal. We really have processes and, the platforms in place to support everyone.
So speaking of measurement, Mindstrong is steeped in years of neuroscience and research. Tell us why that's important. What should the health plans and the audience know about that topic?
Yeah, thanks. And this is really what got me so excited about Mindstrong years ago, right? Because telehealth is just the tip of the iceberg. It just is access. But how can we leverage technology to also be informing us about our mental health on a daily basis? That's really our measurement science. And whether that's typing data, whether that's location, voice, all of these really snazzy signals that you may be reading about, we're poised to be incorporating many of them, right, in order to generate the best picture of how our members are doing, and then ultimately how their outcomes look to their providers. And so it's really, it's about making sure that everything we're doing is measured and that our care is measured. So our therapists are trained in our measurement-based care model from day one. It's integrated into care plans. We're tracking that on the weekly basis with our entire team so that if our members aren't doing well, we can immediately intervene. We don't assume that it's one size fits all. And so we really need to be careful about using the data and lending some objectivity to mental health care that's been so lacking in it for so long.
You've already alluded to quite a bit of this already, and we've talked about the benefits to patients, but tell us a little bit more about what are the problems you're solving for the payers that you're partnering with, and why do they want to partner with Mindstrong?
Yeah, thanks, Salma. Really, like what we hear time and time again is engaging folks, especially those with significant mental illness. So while we're treating people across the whole spectrum, we know that SMI is a differentiator for us. Not many folks in this space are really doing that or doing that well. And I think our payers are keen to make sure that they're that individuals that they're caring for have access to that healthcare at that end of the spectrum. We know that total cost of care, inpatient spend, those are important metrics that payers are looking at, and when we can drive those down, we feel really confident there. But our clinical outcomes, we're not, to my point earlier, we're not just providing access, we're making sure that people get better and stay better and then can maintain that connection with care. We really intend to be that safety net and tether.
Wow, amazing. It really sounds like you've built not only just a holistic solution, but one that really meets the needs of beyond just mild and moderate anxiety and depression, which of course is very important in of itself. But as you mentioned, I think that SMI populations that there hasn't been enough innovation for so long, and it's because it's hard. It's hard to create such amazing holistic solutions that are effective. And so it's impressive to see the work that you and your team have done. So we've been talking a lot about tech tools, digital interventions. I always like to ask folks, how do you know, tech versus touch? How do you know what's the right balance to really make the optimal impact for mental health and well-being of individuals?
Thanks. I love this question because there is not one answer. And really what I really believe about Mindstrong is that it will be a personalized approach, right? And that's the real talent of the tech in order to drive that personalization and deliver up those insights on an individual basis to our providers so that a care plan can be personalized. That's really the role of the technology, right? And that's how we're really going to drive outcomes. I think anybody who approaches this and says, I think that the tech can do this and the provider is going to do this and that's going to work for everyone. No, we've just seen that not be the case. Everything can look fascinating in software on paper, but nothing will work unless there's care delivery that goes alongside it. And so as we're iterating those two at the same time, really, I think that's the secret sauce, right?
Thanks so much. And it's always a pleasure talking, Dr. Dubois. I wish I could ask you so many more questions, but we're already out of time. And so I want to thank you for your expertise and joining us again.
Thanks so much. Take care.